Under RUGS 4, there are several scheduled assessments throughout the resident's stay under Medicare Part A, including possible unscheduled assessments that may be triggered by different events during a patient's stay, such as when a patient starts therapy, ends therapy, or when there's a change in the volume of therapy received by the patient or in the patient's status. Under PDPM, effective October 1st, 2019, there are 3 PPS assessments: the 5-day assessment, the Interim Payment Assessment, or IPA, and the PPS Discharge Assessment. The 5-day assessment and the PPS Discharge Assessment are required. The IPA is optional and will be completed when providers determine that a patient has undergone clinical change that would require a new PPS assessment. Medicare Part A patients are unique and can experience clinical changes which may require a skilled nursing facility to reassess the resident to capture changes in the resident's condition. 2 new item sets have been created as a result of PDPM. The first new item set is the Interim Payment Assessment, or IPA. An IPA is an optional assessment that can be completed at the determination of the provider when a patient's PDPM classification changes due to a triggering event or changes in medical characteristics. The second new MDS item set is the Optional State Assessment, or OSA. CMS has created an optional state assessment so that Medicaid payments are not adversely impacted when PDPM is implemented as of October 1st, 2019. States will have the ability to determine the policy associated with this assessment to meet providers' Medicaid payment needs. The optional state assessment will be in place from October 1st, 2019 through September 30th, 2020. To capture the patient's primary diagnosis, which is used to classify the patient into a PDPM category, CMS added item I-20B, which allows providers to report using an ICD-10 CM code the patient's primary skilled nursing facility diagnosis. The item will ask to indicate the resident's primary medical condition category that best describes the primary reason for admission. Item I-20A under RUGS 4 is being retired on the MDS 3.0, and only I-20 and I-20B will be used. In order to capture surgical information which may be relevant to classifying the patient into a PDPM clinical category, CMS is adding new items in Section J of the MDS. These items are J2100 to J5000. These items are used to capture any major surgical procedures that occurred during the inpatient stay that immediately preceded the skilled nursing facility admission. On the discharge assessment, providers will complete new items in Section O. Providers will report the total amount of therapy, broken down by therapy mode and by therapy discipline, the patient received during the entire Part A stay. If the total amount of group and/or concurrent minutes comprises more than 25% of the total amount of therapy for that discipline, a warning message will be issued by CMS on the final validation report. On the Interim Payment Assessment, Section GG items will be derived from a new Column 5, which will capture the interim performance of the patient. The look-back for this new column will be a 3-day window preceding and up to the assessment reference date of the IPA. New MDS item I-1300 is being added to Section I in order to capture this diagnosis for the NTA comorbidity score. New MDS changes. There are 3 PPS assessments under PDPM. The optional state assessment is aimed to reduce negative impact on Medicaid reimbursement. Section J will capture surgical information relevant to PDPM classification. Section O items will track modes of therapy and compliance with the 25% threshold of group and concurrent minutes. Column 5 in the Interim Payment Assessment has been added for Section GG. Item I-1300 has been added and will help determine the NTA scoring.